Dear students, welcome back. In the previous session we have discussed about transverse tarsal joints. Now in this session we are going to discuss about tarsometatarsal joints. Here you can find the tarsometatarsal joints. How many tarsometatarsal joints? You'll have 5 tarsometatarsal joints. Okay, the tarsometatarsal joints are plain synovial joints formed by the distal row of tarsal bones posteriorly and the basis of metatarsals Okay, so again the numbering is, this one is first, second, third, fourth and fifth. So now we'll see the first metatarsal joint, which is composed of articulation between the base of the first metatarsals with that of medial cuneiform bone. So the first metatarsal joint is formed by the base of the first metatarsal with that of the medial cuneiform bone, and this joint is having its own articular capsule. Now we will see the second metatarsal joint. The second tarsometatarsal joint is composed of the articulation of the base of the second metatarsal with a mortise formed by the middle cuneiform bone and the sides of the medial and lateral cuneiform bones. That means like this. This is the mortise. Okay, this mortise is formed by the middle cuneiform. On the sides it is formed by lateral cuneiform and medial cuneiform. All together forms the second tarsometatarsal joint. Okay, so this joint is set more posteriorly than the other metatarsal joints. So very important thing, the second tarsometatarsal joint is located more posteriorly when compared to the remaining tarsometatarsal joints, and this joint is stronger. So this joint is, the second tarsometatarsal joint is stronger and its motion is more restricted. Okay, now we will see the third tarsometatarsal joints. So the third tarsometatarsal joints are formed by the base of the third metatarsal and the lateral cuneiform. So here, and the lateral cuneiform, and this joint shares a capsule with that of the second metatarsal joint. Okay, next, the basis of fourth and fifth metatarsals. Next joints, the basis of fourth and fifth metatarsals joins with that of cuboid bone, articulates with that of cuboid bone. Here you can see the cuboid bone articulates with the fourth and fifth tarsometatarsal joints. Okay, and these two joints also share a common joint capsule. So these two, fourth and fifth one, is also sharing a common joint capsule, and small plain articulations existing between the bases of the tarsometatarsal joints. Okay, so here in between the metatarsals, so that is intermetatarsal joints, so you'll have some small articulations of these metatarsals also we can see here. Okay, small plane articulations exist between the bases of metatarsals to permit motion of one metatarsal on the next. Okay, So for all these joints, numerous dorsal, plantar and interosseous ligaments reinforce each tarsometatarsal joints. What are those ligaments? Numerous ligaments which are present on the dorsal aspect, plantar aspect, and the interosseous ligaments are present to support these 5 joints. Okay. In addition to all these ligaments, there is a deep transverse metatarsal ligaments which are also present on the plantar surface, and this ligament mainly prevents the excessive motion and splaying of metatarsal heads. That is the main function of this deep transverse metatarsal ligament. Now here in this one we can see the function also, the tarsometatarsal joint function, which includes axis. Here in this session only we are going to discuss about the axis of the tarsometatarsal joints. Okay. Here each tarsometatarsal joint is considered to have a unique, but it is not fully independent axis of motion. So, and some of the studies done by Hicks and proposed the axis for the 5 rays. Here the axis are termed as rays. Here a ray is defined as the functional unit. Keep it in mind. A ray is defined as a functional unit formed by the metatarsal and its associated cuneiform bone. Okay, so this is related to for the first through third rays. So all these 3 are related to the cuneiforms, associated cuneiform bone. The cuneiform bones are included as parts of the movement units of the tarsometatarsal rays because of the small and a relatively insignificant amount of motion occurring at the cuneo-navicular joints. Okay, the cuneo-navicular motion, here you can see the cuneo-navicular motion therefore becomes functionally part of the available tarsometatarsal motions. So that means, the movements which are causing in the navicular also causing concomitant movements on the intertarsal joints. These intertarsal joints also having motion on the tarsometatarsal joints. Okay. So the 4th and 5th rays. So this is about for first 3, and the 4th and 5th rays are formed by the metatarsal alone. So this one the rays are formed by only the metatarsal alone. That means here no cuneiform bones are involved for 4th and 5th rays. Okay, because these metatarsals both articulate with the cuboid bone. Okay, so there are totally how many rays? 5 rays. A ray is defined as the functional unit formed by the metatarsal and its associated cuneiform. So these cuneiforms are only related to the first 3 metatarsals, and the 4th and 5th rays are mainly formed by metatarsals itself. Okay. Now, so according to Hicks, most motion at the tarsometatarsal joints occur at the first ray. So this is the first ray. Okay, first ray and 5th ray. Okay, most of the tarsometatarsal movements are occurring at 1st and 5th rays. So here in this pic also the 1st ray and 5th ray is shown here. Okay, the axis for first and fifth rays are, each axis is oblique. So by seeing itself, each axis is oblique. Okay, and therefore it is by seeing itself, triplanar movements are occurring in each axis. So of the tarsometatarsal joint, the first has the largest range of motion. So the first one will have largest range of motion. The axis of the first ray is inclined in such a way that dorsiflexion of the first ray also includes inversion. Okay, this one which helps in dorsiflexion also includes inversion and also adduction whereas plantar flexion is accompanied by eversion and abduction. This is the movement taking place in the first ray. Okay, but here in this movements, the abduction adduction components normally minimal. Abduction and adduction components are minimal in the first ray. Okay, now we will see movements of the fifth ray. The movements of the fifth ray around its axis are more restricted and occur with the opposite arrangement of components. So this fifth one, the fifth ray here, the movements which are occurring around this axis are more restricted and occur with the opposite arrangement of components. That means here dorsiflexion is accompanied by eversion and abduction. So dorsiflexion is accompanied by eversion and abduction. Okay, whereas plantar flexion is accompanied by inversion and adduction. So this is for fifth ray. This is for fifth ray movements. Okay, so these are the movements taking place in the first ray and fifth ray. So the axis for the third ray nearly coincides. So for the third ray nearly coincides with the coronal axis. The predominant motion therefore is dorsiflexion or plantar flexion. The axis for second and fourth rays were actually not determined by Higgs, but were considered to be intermediate between the adjacent axis for the first and fifth rays respectively. The second ray moves around an axis that is inclined toward but is not oblique as the first axis. The fourth ray moves around an axis that is similar to but not as steep as the fifth axis. So the second ray is considered to be the least mobile of the five. So the remaining all the tarsometatarsal joints have enough range of motion. When we compare with all the rays, the first ray will have maximum range of motion, and next we can see the fifth ray, and third and fourth ray will have we can give the next range of motion increased, and the least one is the second tarsometatarsal joint. Okay. If we see the tarsometatarsal joint function, the motions of the tarsometatarsal joints are independent, as are the motions of the carpometacarpal joints in the hand. Like the carpometacarpal joints of the hand, the tarsometatarsal joints contribute to the hollowing and flattening of the plantar surface of the foot. Okay. So in opposite to the hand, however, the greatest relevance of the tarsometatarsal joint motions is found during weight bearing. Again, here during weight bearing, the tarsometatarsal joint motion we can found very clearly. So in weight bearing, the tarsometatarsal joint functions primarily to augment the function of the transverse tarsal joint. Okay, that is the tarsometatarsal joints attempt to regulate position of the metatarsals and phalanges in relation to the weight bearing surface. That means these always, the forefoot always wants to maintain their position on the weight bearing surface. Okay. As long as transverse tarsal joint motion is adequate to compensate for hind foot position, that means this transverse tarsal joint can absorb maximum forces which are created by the weight bearing. So which helps the transverse tarsal joint helps the forefoot to compensate for the hind foot motions. Whenever the hind foot position is at an end point in the available range of motion, or the transverse tarsal joint is inadequate to provide full compensation, that means the transverse tarsal joint at one certain point it can't absorb the entire forces, so that is the extreme position. Okay, then what happens? The forces are transmitted to the distal joints. Then what will happen? The compensation is not provided by the transverse tarsal joints. Then the tarsometatarsal joints may rotate. So the next one is these tarsometatarsal joints may rotate to provide further adjustment of forefoot position. Okay, so this is the main function of the tarsometatarsal joint function. So it includes to maintain such adjustment of forefoot position. It is doing two functions. One is the supination twist and pronation twist. So these two functions we are going to discuss individually in the next sessions. Thank you.